Cardiac CT. Information guide for patients. The radiology department has received a request for you to have a CT scan of your heart. This information leaflet tells you what to expect before, during, and after the scan. Why am I having this scan? Based on your symptoms, your doctor has referred you for a scan of your heart and its blood vessels. CT coronary angiograms are used to diagnose a variety of heart conditions by taking detailed images of the coronary arteries. Before the scan, please discuss with your referring physician before the scan if there are any medications which you are currently taking that need to be stopped. Please avoid caffeine for at least 12 hours prior to your scan, as caffeine can increase your heart rate, which results in poorer quality images. This includes coffee, tea, including herbal, cola, energy drinks, and chocolate. Please do not eat anything for 4 hours prior to the scan. You can drink water. The day of the scan, you will be met in radiology department by the radiographer who explain the procedure to you and carry out pre-scan checks. Please be aware that even though the actual scan itself usually lasts between 15 to 20 minutes, you may be in the radiology department for between 2 to 3 hours. This is dependent on your heart rate. If your heart rate is above 60-65 beats per minute, then the doctor will give you a medication called beta blockers to slow your heart rate. This is extremely important as a lower heart rate will result in better quality images. It can take up to an hour for the medication to work, so please be prepared to wait a while before we start your scan. It is important to tell us if you have any allergies, or if you have taken beta blockers before which have given you problems. If you are asthmatic and use an inhaler, please tell us, and bring the inhaler with you to the appointment. Please also bring with you a list of all your current medications. A member of the nursing team will put a small cannula, needle, in your arm. During the scan, an X-ray dye contrast is injected, which helps to highlight the coronary arteries more clearly and demonstrates any narrowing or blockages, helping to diagnose coronary artery disease. During the scan, the CT is an open ring-like structure which resembles a giant donut. You will be asked to lie on your back on the scanning table where electrodes will be placed on your chest, allowing the team to monitor your heart rate throughout the scan. The table will move your body through the scanner. You will be asked to hold your breath for a short time whilst the pictures are taken. You will also be given the contrast dye around this time. During the whole procedure, you will be closely monitored by the radiology team from the adjacent control room. After the scan, you will be asked to wait for around 20 minutes before you leave the radiology department. After the scan, you can eat and drink as normal. We will also advise you to increase your fluid uptake for the rest of the day. You will not be told the results immediately as the images require detailed analysis